first time we're using deep learning, a deep learning algorithm in the veterinary space. It mimics how the human brain learns from vast quantities of data. It allows general practitioners to basically offer expert level care at their general practitioner practice, even if they're somewhere rural and they don't always have the option of referral.
Welcome to another episode of the Cause and Effect podcast. I'm your host, Dr. Kara, and today we're diving into a fascinating topic that is shaping the future of veterinary care: artificial intelligence in the veterinary industry. I'm thrilled to be joined by Dr. Paris Ryf, a committed and goal-orientated professional who brings a unique perspective from both clinical practice and the world of animal health innovation. Dr. Paris spent 5 years in private practice, where she developed a passion for fostering meaningful connections and helping others thrive. She also studied marketing during that time, giving her an impressive breadth of experience in understanding what pet owners need the most. Today, she manages the companion vaccine and diagnostic portfolio at Zoetis, South Africa, a company that is dedicated to advancing animal health through cutting-edge pharmaceuticals and technology. Driven by her fascination with AI, Dr. Paris is excited to explore how these advancements can redefine diagnostics, treatments, and overall service delivery, making a real impact on the lives of pets and their owners. We're about to explore how AI can benefit you and your pet, and what this technology could mean for the future of veterinary medicine. If you are new to this podcast or have been enjoying our episodes, don't forget to hit that subscribe button to stay updated. Now, let's get into this conversation with Dr. Paris. A warm welcome to Dr. Paris Ryf. Dr. Paris is from Zoetis, and we're going to talk about AI technology and how it's changing the sort of vet care that we're able to provide. So very warm welcome. Thank you for joining me today.
Yeah, it's an honor to be here. So like Dr. Kara mentioned, I work at Zoetis. We're a global animal health company. We pride ourselves on innovation, and we aim to nurture the world and humankind by advancing care for animals. We've got a number of primary areas of focus, and that's obviously pharmaceuticals and diagnostics and genetics, and we're at the forefront of veterinary in terms of AI. So we've got a new multi-purpose platform. It's called the Imagist Scanner, and we've got a lot more uses for AI in the pipeline. So I think it's quite exciting. I think an important thing to discuss today is why do vets run so many tests? And I think it's because our patients can't talk. They can't talk, so we run tests. And there's a number of different tests that vets actually do run in order to be able to make a diagnosis and actually find out what's going on with your dog or your cat. You know, it's like putting together pieces of a puzzle. So a pet owner will often come in and they'll have a bit of a vague complaint. They'll say, no, okay, let's say, I want to say Fluffy, but I think that name is so overused. Let's say we have a dog called, his name's Yapsnoot. That's a great name. Yapsnoot comes in and he's not feeling himself. And, the pet owner's been busy at work, and they're like, no, Yapsnoot's he's not himself. He's just, he hasn't really got his sparkle. Now, vet must work off that. So that's generally why we do tests. And we do a number of different tests. We generally look at the blood because, blood transports oxygen and nutrients and removes waste from every organ and tissue in the body. And there's different parts of blood that we can look at. We can look at the serum, which is the liquid component of blood. We can look at the blood cells, which is, red blood cells, white blood cells, which are involved in the immune function, and platelets, which are involved in the blood clotting. And there's other tests that we can do. We can do fecal analysis, we can do skin tests, we can do urinalysis. There's a whole lot of different tests. And what we've done, like what veterinary medicine is based off, is reference intervals. So we know what is a normal range for a dog, what is a normal range for a cat. And if we run a test and it's lower than the normal range or higher than the normal range, we then know that there's an issue there. And we may be looking at, say, liver values, and if they're higher than normal, we know that there is a liver insult. And doesn't mean the liver's offended. When we say liver insult, we mean there's an issue with the liver, like a disease process. That's what we mean by an insult. You can't say, no, I don't like your liver. Now there's an analyte that's going to be raised. It doesn't really work like that, but we refer to it as an insult or an injury. It's quite exciting. Zoetis, we've got a range of toys or instruments. We've got the VetScan VS2, which does the biochemistry. We've got the HM5, which is hematology. And like I mentioned earlier, we've got Imagist, which is like a new camera and microscope in one, and it uses cloud-based artificial intelligence software in order to run a number of different tests. And this is pretty cool in the veterinary space. like when you start talking about artificial intelligence and like what is artificial intelligence, and that's basically it's an algorithm that can perform a task that would normally require human intelligence to execute that function. So we've actually used artificial intelligence in veterinary for quite a while. We've used it for urinalysis tests. But we've normally used superficial machine learning. So that's where you give predefined rules to an algorithm, and then it can execute a task, but it can't anticipate the next move. It can't learn from any of the data it's been provided. Deep learning, which is, Imagist is the first time we're using deep learning, a deep learning algorithm in the veterinary space, is quite different because it mimics how the human brain learns from vast quantities of data. So how the Imagist is trained is that we give it expert classified images, and then what it does is it makes its own rules. So for example, with parasite detection, we will give Imagist lots and lots of images, taken of parasite eggs, hookworm eggs, roundworm, whipworm, tapeworm, Coccidia giardi, all the usual suspects that you find in the dog parks that cause gastros and things like that. And then Imagist, the platform, will actually make its own rules and be able to correctly classify those images. Even if the egg is presented upside down, it's actually able to correctly classify them at the level of an expert. So this is great for veterinary because it allows general practitioners to basically offer expert level care at their general practitioner practice, even if they're somewhere rural and they don't always have the option of referral. So this is great for pet care. It allows us to have expert level care at an affordable price point in a reasonable point of time. So I don't know if you've heard anything about AI in veterinary. There's many other applications, but
Absolutely.
Yeah, Imagist has really been. I think it's a game changer.
No, we've been really privileged. Even our practice management software has the AI capability, and
Oh, great.
What we're seeing is it's a time saver and a way
Yes.
of sort of managing and reassessing and getting another eye in the game. So, where I think there was always the concern that, it's going to be incorrect, it's going to cost a lot of money, we worry about the capabilities of AI taking over. I think when most pet owners hear AI technology, they, visualize Elon Musk's robotic men. It's not going to take over what we do practically, but it aids in, like you say, a lot of the things that are very time consuming or would otherwise, be questionable. And having that capability is phenomenal.
Yeah, so AI I think the advantage of AI is it can eliminate redundancy. So perhaps note-taking, things like that, and, looking under a microscope and classifying, parasites or it should actually save a vet time and free them up to do important tasks like actually dispensing or operating or working with the patient or talking to the client, things that AI cannot do. It's supposed to actually save time and help the vet to do more veterinary specific things. And also it allows, like I say, GPs to practice expert level medicine. Now, I still think there will always be a space for referral clinics if a patient needs a specialized surgery or a specialized workup, or they need a scope or some kind of a hands-on touch. Like that's why I say AI will never replace vets. It'll never replace doctors either. It's I think it's just going to make their lives a little bit easier. What will happen is that vets that use AI will replace vets that don't use AI. That's basically what will happen. I think it's tremendous. There's also AI it's on the forefront of diagnostic imaging now. So now we've got AI platforms that help with making diagnosis with X-rays. Where normally you would need a radiologist's input. Now you can upload it to a cloud. And there's platforms that are offering that, and then you can get an answer. Is it a foreign body? Is that a mass worth worrying about? Is it just an artifact? And sometimes, if you're a sole practice, you can't phone a friend, especially in South Africa. Sometimes you're in an outlying area, and you can't refer anywhere, or maybe it's you need to make a decision then and there. And now you've actually got access to an expert level, expertise. Somebody can make a recommendation for you. So absolutely. I think it's an absolute game changer, and for the win. It's a positive for pet owners and for vets alike.
And some of those provisional diagnoses can then be actual confirmed diagnoses, which can change the time frame of managing some of these disease processes. And like you said, you can put the parasite control in place. You can treat accordingly, whereas before it was like, oh, I'm not really sure. And so it also improves the learning opportunity for vets. I mean, what we're finding a lot of our vets are doing with what we're working with your imagist is that they'll run tests on the side, and they'll have a look and see what they find, and then they see and it's a great learning opportunity because we otherwise wouldn't have that confirmation. One of the things I wanted to discuss with you, and one of the things that we get a lot of pushback on, is when tests come back and there's nothing wrong. So can you discuss the benefit of running tests even when all the parameters are normal? Because I always feel that it's a winner. So I'd love your approach on how you manage this.
So, look, the thing is, what is a question that when I go back in time and think about time in private practice, like a very sad question to answer is there anything we could have done when you are delivering something like a terminal diagnosis or a poor prognosis, and you've got a cat that's come in and's got end-stage renal disease, or a dog that's got like this very advanced liver condition, and now the liver is cirrhotic. It's sort of an end-stage liver. Pet owners always ask, is there anything I could have done? And the answer is usually you could have brought your pet in sooner, because the issue is a lot of these chronic ongoing issues, they start off with subclinical disease. And clinical disease is when the patient is actually, you can actually see that they're apathetic and their appetite is poor, and they're just not really themselves. But the disease process has actually started and been festering for a long time before then. And dogs and cats they like to mask their symptoms. They don't want to let on that they're not feeling good. They want to please you. And cats, sometimes it's very, very difficult to know if they're not feeling good. So often they have very advanced renal disease by the time they come into the clinic. And that's why it's important. I recommend that all patients, even over the age of 5, should get a blood test at least once a year, even twice a year, and even an abdominal scan, just to pick up if there's something that's brewing. And if it's normal, that's great. That's what you want. You don't want anything to be abnormal. You want to be able to intervene if it's increasing within the reference interval. That's where you're picking up subclinical disease. Clinical disease is when there's overt clinical signs, and then sometimes you're very limited with treatment options. Some diseases, infectious diseases, if it's like a bacterial infection, you can clear it up with antibiotics, but a lot of the other conditions, no, you need to catch it early and nip it in the bud, or at least manage it. And if you catch it earlier and intervene earlier, that can make the world of difference. And that's why I don't think blood tests are ever a waste of money. You shouldn't only do it, fork out before they go for general anesthetic. Yes, it's a good idea to make sure the liver and the kidneys and everything are normal before you proceed with the surgery. That is great. But, I think just for normal pets, just to have a baseline indication of what is normal for them, it's a good idea just to do a blood test. We do it with human, like we've got medical aids, and they encourage us to do all these blood tests and things like that. The Discovery does this vitality program, and we really should be thinking like that with our pets as well.
Absolutely. But also, I suppose from the perspective where we might be giving medication that might impact those things, or it's nice to watch the progression, like you said, picking up subclinical disease as well as saying, okay, I've picked up something that's now going to change the course of how I manage this case. Or when I can't remember your example pet's name, but when I did this test on my Fluffy, that's it. The results were this, and now doing it a year or two later, that is now shifted, which is already indicating it may not be out of the reference range to say it's abnormal, but this is now abnormal for this pet. So many reasons why, if owners want to be proactive, we encourage them to do so, not because we want to make money from it, because we really want to do the best for their pets.
Exactly.
So and for people who feel that it's expensive, how can we justify the expense associated with this? These tests are not.
the thing is, like, it's time. Time is money, right? And you can buy time. And I think compared to human medicine, where we actually offer expert level care, we offer the same level of care as a human hospital. Vets charge a fraction of the price, and we people are insulated from that price parity or that price point because medical aids absorb the costs, and we don't really see it. Pet owners have to pay cash everything for the pets. But what happens with the human doctors, you go to them, they're not quite sure what's wrong with you, and then they send you to a lab with the form, and then you have to wait for days on end to get the results. Then you have to go back to the doctor for the interpretation of the results, and sometimes they can't even interpret it. They have to send you to a specialist to interpret it. Versus a vet who says, okay, you can just wait, we'll phone you back with the results later. You get same-day testing and treatment, all and perhaps radiographs and ultrasonographic scan, all in the same day, managed by the same general practitioner, and you get feedback that very same day, and a treatment plan. So I think the cost of tests often. Vets have a very low markup on tests. That's what I've seen, my experience, because I work with the diagnostics, so I see vets markups, and they often don't mark it up, or they mark it up very minimally, and often things go wrong with tests, and then they actually write off a lot of the consumables. So I think it's not absurd, it's not obscene, and I think to do a proper workup and run those blood tests and make sure that you're making an accurate diagnosis is a lot better than treating and seeing and maybe this is right and this is wrong, and you're actually missing the mark and treating the wrong thing and actually wasting precious time, because sometimes these conditions can become life-threatening. And that's basically it. To do a quality workup is going to cost money, but it's also going to help you hit the bullseye on the diagnosis.
Hey there, pet parents. It's Dr. Kara, the ultrapet vet here. Brachycephalic, meaning short-muzzled, dogs have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultrapet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultrapet offers a 100% money-back guarantee. Try Ultrapet's premium recipe for short-muzzled dogs today. What's coming up in terms of the advancements? What has Zoetis got up their sleeve next?
So artificial intelligence, we're using to actually develop new molecules I'm sure you've heard of our new arthritis treatment for dogs and cats. I obviously can't mention the name because it's a scheduled medication, but we're using it to speed up the approval process and development process of new drugs that are going to be game changers in prolonging pets' lives, and also managing chronic diseases. So that's what we're doing, because, like, to give you a little bit of insight, to develop a new, say, biological product, say it's just an example, a vaccine, takes sometimes 7 years in a first world country, and then by the time it reaches South Africa, it can be 15 years post development. So artificial intelligence is going to help speed up those kind of the hoops that we have to jump through to get things approved. And I think that's going to be wonderful, because what we're seeing is that pet parents really care. They're working more from home. They've got these hybrid jobs. They're at home. They can see when their pets are not feeling well. And it's like it's part of their family. It's not just a guard dog in the garden anymore. And cats are part of the family. And people are, they've got these cats with these intricate personalities, and they're watching them, and they're trying to bring them in for, preventative testing and things like that. So, it's the era of the conscientious pet owner, the connected pet owner, and they're picking up subtle changes in their pets, and actually they're picking up on things like their pets' mental health, which is wonderful. People are really looking after and stewarding their pets, which is great to see, and it's awesome to be embracing, to be on this time. It's a good time to be alive. I think it's exciting. Like, pet owners are entering
evolving.
A new era. Yeah, they really care. Yeah, that's it. It's an evolution, and now we've got this whole artificial intelligence thing, bringing new products to the market at faster than before. And it also improves like forecasting timelines. It helps with everything: regulatory forecasting, development of new drugs. So I think it's, a lot of conditions where there are no or limited treatment options, that's going to change in the future. I think the future's looking very bright for pet care. And also like the artificial intelligence, like you said, practice management software, a lot of the admin type things that bog vets down, taking soaps or making notes and things like that, I think is going to be streamlined through artificial intelligence. So the vets can spend more time actually caring for pets and communicating with pet owners, things that artificial intelligence can't do. So I think that's great, and that's very exciting.
But even the
Yeah.
communication. So obviously being based in South Africa,
Yeah.
some of my staff, their first language is not English, and so
Yes.
being able to communicate with the assistance of AI and telling them exactly what they want to tell the pet owner, or relaying information back to them in a way that is presentable, professional, but also without typos and things that really do I think impact owners significantly in terms of their perception of your practice. So there are so many benefits for us from a practice management perspective, and then, like you say, even the time and the diagnostic capabilities. I think we've got to embrace AI technology and see it for its benefit. But some of the concerns have been, what happens to our data? How do you manage this question? Because obviously people are very concerned about data protection these days, and they feel that AI is it's kind of being released to maybe a third party, and they're now vulnerable. I don't know what they think we're going to do with it, other than maybe get a spam call. But
no, well, I know with our artificial intelligence, we've got lots of legal laws of governance and things like that. So it's stored on a cloud, but it's a secure cloud, and each account has got its own security measures. So there's no third party sharing or anything like that.
What else do you think is relevant that we should chat to, that you've heard as sort of misconceptions or concerns about AI technology?
So, I think one of the biggest concerns is that people are feeling like artificial intelligence is going to make people redundant. And I really don't think so. I think artificial intelligence has actually created a whole lot of different jobs, and has freed up a lot of time for us to actually spend with our pets by eliminating redundancies. That's what I think artificial intelligence is doing. But it might be a good idea to embrace things like trades where you don't need things like artificial intelligence. But I think it's a good thing, and change is a good thing, and it's industry 4.0 is the era that we're living in. And so technology, people think it makes our lives easier, but I actually sometimes think it ends up making things a lot more busy. And I see now that there are more and more positions for things like chief information officers and artificial intelligence governance, things like that. There's just a whole lot of new jobs being created, because there's just like now so much information, and things making sure that validating that AI is actually correct. So I think it's a very exciting thing, but it's still very new. So there's a lot to come. There's a lot to come.
And I think a lot of people are threatened. People are threatened by change, but as we've seen, if I think back to pre-cell phones and TVs and things, there has been a lot of change. It's just sometimes when you're very involved with the changes, my son embraces it like it's expected, but I think because we've seen this evolution, that sometimes there are fears, normal fears, that are associated with this rapid change. And I think probably my only negative of the change is that sort of instant gratification, that need for information immediately, that sort of pushing, and that like you say, in a busy world, that can put a lot of pressure on us as professionals. I want the information, I want it now, I want a result. And so in terms of trying to keep up with that technology, it means you have to invest in the change or be left behind.
Yeah, no, absolutely. And I think vets are already under a lot of pressure to have fast turnaround times. And it's, when you're doing a medical workup, if you look at how long it takes to get an answer and a diagnosis in the human medicine field versus veterinary. It's very different. We run all our blood tests in-house. You often have the patient admitted, and then by the end of the day, you've got like a whole treatment plan and regimen lined up. And sometimes they need to be admitted and managed for a few days in hospital, but you get daily callbacks where you don't really get that with human doctors. And I do understand it's set up differently in hospitals. But I think people need to be realistic, just because technology is getting faster and better, biology is not operating at that level. They need to have realistic expectations, and also vets are managing a lot of patients. I mean, some vets see 30 patients a day, and they need to practice gold standard care with each and every one of those patients, and they really do. They really do care, and they phone back every owner and give them an update. It's high stakes on vets, and as we know, there's a critical vet shortage. So if they can use artificial intelligence as a crutch, I'm going to say go for it. Like, we know that there's 150 vets qualifying a year and 100 leaving the country. There's definitely a critical shortage. We need to look after our vets. So, be nice. Pet owners are nice to the vets, because the vets really do care. They really are doing their best. And if they want to use artificial intelligence to help them do the workups and remove the redundancy so they can spend more time with the pet owners and the pet parents, I think it's a good thing.
And the stress of getting it wrong. I mean, if we're totally upfront, we're human.
Absolutely.
And so to have your diagnosis confirmed is a gift.
And have access to the virtual lab. They have the option of virtual referral Zoetis, we've got the virtual lab, so that's like a lifeline for vets. They've got access to a medicine specialist, oncologist. They can speak to dermatologists if they've got a weird skin case. So it's so great that you can phone a friend, even exotic specialists. If you get a parakeet or something, and you're not quite sure how to work it up, and it's got a sensitive lung, air sac issue. It's great to be able to speak to an exotic specialist, because sometimes in rural areas you don't have access to these kind of specialists.
And they wouldn't receive that kind of care otherwise. You're right.
Exactly. So I think it's a very good thing for pet owners. Better gold standard care for everybody.
Definitely. And in terms of, are medical aids accepting the diagnostic tests that you're offering through Zoetis? Would you encourage owners to be insured?
It depends on the plan, but I really do. I think pet insurance is definitely a game changer. That is the difference between us and first world countries. Why they can spare no expense. If you go to places like the United Kingdom, and there apparently a spare is 14,000 rand for, it's a fraction of the price here in South Africa. But there, the pet owners pay, and it's covered. It's part of their household insurance. So, I think there's a need for very comprehensive pet insurances in South Africa, and there are a number of options, and they are on the increase. But I think that's going to be a game changer for pet parents. So, pet insurance, I think it is essential. You hope you never want to use it. You hope you have a healthy pet for that doesn't have any ailments, and they're just happy-go-lucky and don't really run into issues. But with big unexpected expenses, it's really nice to have it as a backup. You don't want to be counting pennies, and unfortunately these things do happen, and they happen, and it's a grudge purchase. You weren't expecting it for it to happen. Maybe there were other expenses that month, and now you really need to fork out, and you need to fork out fast, because often these things are very sudden, and you don't have the luxury of time. You're in that clinic, you need to make a decision because something serious has happened, and you don't know if you can release the finances another way. So pet insurance is very, very important, and what we're seeing is they do encourage preventative testing, so that you don't leave a condition festering and then only find out when the disease has now progressed to clinical disease from subclinical disease. Whereas if you'd picked it up earlier, the pet would have a longer and healthier and better quality of life than leaving it to when they're actually developing signs and going off their food and being depressed and lethargic. So big game changer.
Yes, absolutely. And your advice for vet practices who are considering taking on the images, for example, or this technology, what would you want to say to them in order to sort of relay their fears?
Yeah, so I would look at, we have non-binding contracts, so it's, if the image just is not a good fit for your practice, I would give it at least 6 months though. And when you see that how pet owners respond to having a printed report, so it's quite nice. Like Imagist is awesome. Traditionally, vets will run a test and then they'll look under the microscope, then they'll walk out and speak to the pet owner and say, I saw this under the microscope. Now with Imagist, you actually have a customized report with the pet's name, and then you've got images of, say, the worm's eggs, or you've got images of the cells from the slide that you did a fine needle aspirate of. You can go there and talk to the pet owner, and there's power in that. Pet owners love that. They love to be part of it, and you can explain to them like the different worm eggs. It's really a different conversation to saying, no, I saw this under the microscope. They feel they're part of the solution. They can actually see with their own eyes this customized report. And it actually improves compliance, because now they feel, okay, no, I'm going to try and eliminate this condition, or we're going to work together on a treatment plan. So there's definitely power in that. But at the same time, it's totally new technology. So years ago, people used to object to running biochemistry. They think, oh, no, it's fine. We'll just take our chances, treat and see. And that we've seen how that's changed over the years. Hematology as well was regarded as redundant. Even at one stage, people were not really doing blood smears. I don't know how you can get away with that in South Africa with biliary being rife. But it's the evolution. So vets that use artificial intelligence will definitely replace vets that don't use artificial intelligence, because it's what pet owners want. They want to feel like they're part of the diagnosis and the solution. They want to see, if you're charging them for a test, they actually want to see what they're paying for. It's and you can do that with Imagist. It's not just I saw this or I did that or the results were negative. You've got a paper there saying negative, and there's no images of say parasites or rods or cocci if you're doing a dermatology skin sample. So yeah, that's what I'd do. I'd give it a chance, and it's a change in behavior with the vets, and it's a change in behavior with the customers. But yeah, it definitely works well at the clinics that we've seen, and the feedback's been tremendous from
Absolutely.
The vets.
Yeah, we're thoroughly enjoying it, I must say. We're delighted.
I'm glad. Yeah. Sounds like a progressive clinic. You've got artificial intelligence, and you've got a cat-friendly ward. So that those are the trends. Like cat ownership is on the rise as well, which is great. Because people often don't know that their cats are ill, and they can be. Like arthritis is so like we said, under-detected in cats. Yeah.
Yes.
It's a challenge. Yeah, because they sleep so much. So you don't know. They're sleeping 19 hours instead of 18 hours. There's an issue. Yeah.
No, so true. No, thank you. I mean, the work that you're doing is absolutely cutting edge. It's phenomenal. So congratulations for being involved. And thank you so much for taking the time telling us all about it. It's very exciting. And I'm waiting to hear what's coming next. And thank you for giving me a little insight into what you're working on. So I sit in anticipation, but it's really revolutionary. So I'm delighted that we can invest in it, and that we can offer it to our clients, and certainly improve our patient care. It's brilliant.
Thanks, Karen. No, great to chat to you. It was an honor. Wish you all the best.
Yeah, thank you so much. Thanks, Paris.
Very
cool. Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today, and we'll deliver pronto.
Wow! I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.